'Tis the season for getting sick. Officials now say there is very high flu activity across the state of California. And when you throw in cases of RSV and COVID-19, you've got a pretty sick population here in the state. NBC4's John Cuddy's Klimek live at Northridge Hospital with the bad and the good news here. John.
Yeah, there's talk about this triple demic, where if you get all three of these, we're talking about the flu, COVID-19, and RSV, this respiratory illness. So the bad news is the flu and COVID, those are still high, but there is some good news with RSV. There is a downward trend that appears to be plateauing right now. So it seems, as you know, since COVID, we've all kind of become experts or had to become experts to learn things quick through all this. Today, the California Department of Health saying the state is listed as very high when it comes to the CDC's list of influenza activity. That is not good, considering we don't usually see the flu until much later. And doctors here say that there is reason to sound the alarm, especially if you consider the possibility of being sick with the flu, with COVID, with RSV, or with a mix of any of those.
Flu is peaking very high this early in the season. We usually see it in January, February time, but we're seeing it in December. We've been talking about this for months now. RSV, influenza are very high early in the season, and so it makes us worry and wonder what's going to happen this month in January when infections usually are higher.
So the recommendation is what you'd expect it to be. Wash your hands, stay home if you're sick, wear a mask if you're in crowded places. In LA County today, more than 3,000 COVID cases, 10 deaths, and more than 1,200 people in the hospital right now with COVID. Reporting live in Northridge, I'm John Cuddy's Klimek, NBC4 News.